Let me tell you about Eleanor. Eleanor was 71 years old, a retired English teacher from Cleveland, Ohio. She came to me 4 years ago, 6 months after her second cardiac event, carrying a folder of discharge papers and a question she had been sitting with since she left the hospital. She asked me, "Doctor, I am doing everything they told me. Why does my chest still feel like it is working twice as hard as it should?" I asked her to walk me through a normal day of eating. By the time she reached breakfast, I already had part of the answer. Every morning, she was eating 2 processed cheese slices melted over eggs, a tablespoon of jarred cheese spread on toast, and pre-shredded cheddar folded into her egg whites. She had cut out red meat. She had cut out fried food. She had eliminated the salt shaker. What nobody had told her, what had never come up in a single cardiology appointment, was that the combination of industrial phosphate emulsifiers, oxidized fats, and sodium compounds she was eating every morning was delivering a slow, compounding assault on the arterial walls and cardiac tissue she was working so hard to protect. Within 8 weeks of restructuring her dairy choices, her cardiologist noted measurable improvement in both her blood pressure readings and her inflammatory markers. Eleanor called me and said, "I feel like somebody finally told me the truth about what was in my own refrigerator." After 30 years of practice, I can tell you this without hesitation. The cheese aisle at your local grocery store is one of the most underappreciated battlegrounds in cardiac health for seniors. Some cheeses eaten regularly after 60 actively reduce systemic inflammation, lower blood pressure through real physiological mechanisms, direct calcium into your bones rather than into the plaque accumulating in your coronary arteries, and support the gut microbiome that regulates cardiovascular immune function. 4 other cheeses eaten regularly after 60 deliver the exact industrial combination of sodium phosphates, emulsifying agents, and oxidized lipids that drive the stroke, heart failure, and coronary disease you are working hardest to prevent. I am Dr. James Hargrove. I am a board-certified internist with 30 years of clinical focus on cardiovascular disease prevention and senior nutrition. Today, I am going to walk you through the 4 cheeses every cardiac patient and heart health conscious senior over 60 should be eating regularly, and the 4 you need to stop buying immediately. For every dangerous cheese on this list, I will give you the direct replacement that costs about the same, tastes about as good, and does the exact opposite of what those harmful cheeses are doing inside your arteries every single day. Drop your city and your age in the comments below. Tell me which cheese you eat most often. I read every single one personally. Hit subscribe and turn on the bell. Now let us begin with the best. The 4 cheeses to eat after 60 for cardiac health. Number 4, aged Gouda. When real Gouda is aged for at least 18 months, 2 things happen at the chemistry level that matter directly for heart health. First, the proteins break down into smaller, bioavailable compounds called bioactive peptides. As stomach acid production declines after 60, your ability to extract nutrition from complex protein chains becomes progressively less efficient. These pre-digested peptide structures bypass that problem entirely. For cardiac patients on multiple medications who are already dealing with nutrient absorption challenges, bioavailable protein from a whole food source supports lean muscle maintenance, and peripheral muscle efficiency directly reduces the workload placed on your heart. Second, aged Gouda contains exceptional concentrations of vitamin K2. Most people associate vitamin K only with blood clotting. Vitamin K2 is a separate compound with a profoundly different role that is specifically relevant to cardiovascular disease. Vitamin K2 acts as a biological traffic director for calcium. Without adequate K2, dietary calcium tends to deposit in the soft tissue of arterial walls, forming the calcified plaque that stiffens arteries and drives the coronary artery disease responsible for most heart attacks. With adequate K2, that calcium is directed into your bones and teeth where it belongs. A landmark analysis from the Rotterdam Heart Study followed over 4,000 adults for 10 years and found that those with the highest dietary K2 intake had significantly less arterial calcification and meaningfully lower rates of cardiovascular mortality. Participants in the highest K2 intake group had a 57% lower risk of dying from coronary heart disease compared to those in the lowest group. Aged Gouda is one of the densest natural food sources of vitamin K2 on Earth. How to eat it? 1 ounce alongside whole grain crackers or sliced apple, 2 to 3 times a week. Good aged Gouda runs $18 to $24 a pound, but at 1 ounce per serving, that is roughly $1.50 per sitting. Number 3. Authentic Parmigiano Reggiano. This is not the green can of pre-grated powder on the supermarket shelf. That product is largely cellulose filler with preservatives. We are talking about the genuine wheel sold by weight at the deli counter, aged 24 to 36 months. It is one of the few foods with a legally protected name and a production method unchanged for nearly 900 years. A single ounce contains approximately 10 grams of complete protein in effectively pre-digested form. The extended aging process breaks down complex protein chains so thoroughly that your body absorbs them with minimal digestive effort, even in seniors whose stomach acid production has declined substantially. The heart is a muscle. It requires adequate complete protein to maintain the integrity of cardiac muscle tissue, and cardiac patients are chronically underserved in bioavailable protein from whole food sources. The calcium content is approximately 330 milligrams per ounce, more than a full glass of milk. But here is what makes it distinctly valuable for cardiac health specifically. The calcium in authentic Parmigiano arrives alongside the precise ratio of phosphorus and magnesium that a real whole food source provides, supporting absorption into bone tissue rather than into arterial walls. Research from Italian nutritional institutes has shown that calcium bioavailability from Parmigiano Reggiano approaches near complete absorption, compared to only 25 to 30% from isolated calcium supplements. For cardiac patients who are often prescribed supplemental calcium, this distinction matters enormously. Whole food calcium behaves differently in the vascular system than supplemental calcium. The aging process renders this cheese essentially lactose-free. It also contains naturally occurring tyrosine, an amino acid your brain uses to produce dopamine and norepinephrine, neurotransmitters that support mood stability, both of which are under significant pressure in patients managing chronic cardiovascular disease and the psychological burden that accompanies it. How to eat it. Break it into small, natural chunks rather than grating it. Roughly 1 ounce after a meal a few times per week. A wedge at the deli counter runs $12 to $15 a pound. Number 2. Aged sharp cheddar from grass-fed cows. Here is what I actually recommend to most of my cardiac patients on a fixed income. A good quality, sharp, aged cheddar from grass-fed cows, pasteurized but minimally processed, aged at least 9 months, available at most American grocery stores for $7 to $9 a pound. The best version, raw, unpasteurized, aged at least 60 days, is hard to find and runs around $18 a pound. The pasteurized version delivers approximately 80% of the same cardiovascular benefit. Cheese made from grass-fed milk contains 3 to 5 times more conjugated linoleic acid, CLA, than cheese from grain-fed cows, along with a significantly more favorable omega-3 to omega-6 fatty acid ratio. Both have direct, well-documented anti-inflammatory effects that are central to cardiac health, not peripheral. Chronic systemic inflammation is not a side effect of cardiovascular disease. It is a core mechanism. The C-reactive protein and interleukin-6 markers that cardiologists track as cardiovascular risk indicators are markers of inflammatory activity. CLA from grass-fed dairy has been shown in controlled research to reduce these inflammatory cytokines and improve lipid profiles in ways that pharmaceutical anti-inflammatory interventions attempt to replicate chemically. The omega-3 to omega-6 ratio in grass-fed cheddar also directly counteracts the inflammatory imbalance created by the modern Western diet. That imbalance drives the vascular inflammation underlying atherosclerosis, plaque instability, and the thrombotic events that cause most heart attacks. Grass-fed aged cheddar also delivers meaningful concentrations of vitamin D, independently associated with increased cardiovascular mortality in multiple large population studies when deficient, and the MK4 form of vitamin K2, essential for preventing the arterial calcification that stiffens coronary arteries and triggers cardiac events. How to eat it. 1 ounce paired with fresh fruit or whole grain bread, 2 to 3 times per week. Allow it to come to room temperature first. Pair it with naturally fermented vegetables like sauerkraut for a combined gut microbiome benefit that directly supports cardiovascular immune regulation. Number 1. Authentic Swiss Gruyere. Real Gruyere earns the top spot because of a specific mechanism that no other commonly available cheese delivers with the same clinical consistency. One with direct and documented relevance to the most immediate concern of every cardiac patient: blood pressure. During Gruyere's minimum 12-month aging process, the propionic acid bacteria that Swiss production law mandates generate small peptides with clinically documented ACE inhibitory activity. ACE, angiotensin-converting enzyme, is one of the primary biological pathways through which blood pressure is regulated. ACE inhibitors are among the most commonly prescribed medications in all of cardiology. The effect from Gruyere's lactopeptides is modest compared to pharmaceutical doses, but the mechanism is identical and the clinical documentation is real. Multiple trials on fermented dairy products containing these specific peptides have documented measurable reductions in both systolic and diastolic blood pressure over weeks of regular consumption. For a cardiac patient whose blood pressure is already managed pharmaceutically, every additional physiological support for that regulation matters. Beyond the blood pressure mechanism, Gruyere delivers the highest concentrations of glutathione precursor compounds, particularly cysteine and glycine, of any commonly available cheese. Glutathione is your body's primary internal antioxidant, and its natural production declines significantly after 60. This decline contributes directly to the accelerating oxidative stress that damages the endothelial lining of blood vessels, the inner surface of your arteries that controls inflammatory response, platelet aggregation, and arterial tone. Oxidative damage to the endothelium is one of the earliest and most critical events in the development of atherosclerosis. Giving your liver the raw materials to produce more glutathione through the food you eat is a form of cardiovascular protection that no isolated supplement replicates with the same systemic efficiency. Gruyere also provides vitamin B12 in highly bioavailable form. B12 deficiency produces elevated homocysteine, and elevated homocysteine is an independent, well-established risk factor for coronary artery disease, stroke, and cardiac events in older adults. It damages arterial walls directly and promotes the inflammatory cascade that accelerates plaque formation and instability. How to eat it. Melt it gently into a vegetable soup just before serving, or pair small pieces with whole grain bread. A few servings per week is sufficient. Real Swiss Gruyere runs $18 to $24 a pound. American-produced versions run $12 to $15 and deliver most of the same cardiovascular benefits. The 4 cheeses to stop eating after 60 if you are a cardiac patient. Number 4. Processed cheese slices. By federal definition, most individually wrapped orange cheese slices are not legally classified as cheese. They are classified as pasteurized processed cheese product, a regulatory distinction that matters clinically. These products can contain less than 51% actual cheese, with the remainder consisting of sodium phosphate, sodium citrate, emulsifying salts, artificial colors, and industrial vegetable oils. The cardiac concern is immediate. 2 slices deliver over 600 milligrams of sodium, more than a quarter of the entire daily sodium target for adults over 60 managing cardiovascular disease. And this sodium is not natural salt. It is sodium phosphate compounds specifically and repeatedly linked in research to accelerated arterial stiffness, impaired kidney phosphate clearance, and increased cardiovascular mortality in older adults. The distinction matters because sodium phosphate drives phosphate levels into ranges that activate fibroblast growth factor 23, a hormone that at elevated concentrations directly predicts cardiovascular events and cardiac hypertrophy. The emulsifying agents, including polysorbate 80 and carboxymethylcellulose, have been shown in repeated gut microbiome research to erode the mucus layer protecting the intestinal lining, increase intestinal permeability, and selectively reduce populations of anti-inflammatory bacterial species. This gut dysbiosis generates systemic endotoxin exposure, elevates circulating inflammatory markers, including CRP and interleukin 6, and drives the chronic vascular inflammation that cardiac patients are already managing as their primary disease mechanism. The swap. Buy real sliced cheese at the deli counter, sliced fresh from a block of aged cheddar or Swiss. Same price per serving. Real food, no industrial phosphate load. Number 3. Pre-shredded cheese in bags. The anti-caking system manufacturers add to prevent clumping during storage typically includes cellulose from wood pulp, potato starch, and in many products, natamycin, a clinically active broad-spectrum antifungal antibiotic compound. Chronic dietary exposure to natamycin has the potential to suppress beneficial fungal and bacterial species in the colon, contributing to the gut dysbiosis that generates the systemic inflammatory load directly implicated in atherosclerosis progression and plaque instability. The increased surface area created by shredding dramatically accelerates oxidative degradation of the vitamin K2, conjugated linoleic acid, and beneficial omega-3 fatty acids that make real aged cheese valuable for cardiovascular health. By the time a cardiac patient opens that bag and adds it to their meal, a meaningful percentage of the cardiovascular benefit has already been destroyed by oxidation during storage. Pre-shredded cheese also contains significantly elevated histamine levels compared to equivalent block cheese. Histamine triggers cardiovascular reactivity, including tachycardia, flushing, and blood pressure fluctuation in sensitive individuals. Histamine sensitivity increases significantly after 60, as diamine oxidase enzyme production declines naturally with age. The swap. Buy block cheese. Shred it yourself immediately before use. 5 minutes of extra effort preserves the nutrient profile, removes the additives, and costs the same or less per ounce. Number 2. Jarred cheese spreads and squeezable cheese. Most shelf-stable jarred cheese spreads contain more modified food starch, fractionated palm oil, and industrial emulsifiers than actual milk fat. The processing required to achieve room temperature shelf stability destroys nutritional integrity while concentrating the ingredients most damaging to cardiac health. The processed fat issue is direct and serious. Many cheese spreads contain highly processed seed oils and intraesterified fats that promote an atherogenic lipid profile, raising LDL, lowering HDL, increasing systemic oxidative stress, and impairing endothelial function. For a cardiac patient whose endothelial integrity is already compromised by disease, a daily source of these pro-inflammatory lipids works directly against arterial recovery. A single 2 tablespoon serving frequently delivers 400 to 600 milligrams of sodium, primarily from sodium phosphate and sodium hexametaphosphate, specifically linked in research to accelerated vascular calcification and elevated fibroblast growth factor 23. Many products contain monosodium glutamate concealed under labeling terms like natural flavoring or autolyzed yeast extract, linked to cardiovascular reactivity in sensitive individuals. And phthalate compounds that migrate from flexible plastic packaging into fat-rich products over extended shelf life have been associated in research with endocrine disruption and increased cardiovascular risk, conditions of compounding relevance to the cardiac patient population. The swap. Real fresh ricotta or a small log of goat cheese, choosing brands with the shortest ingredient list. Spread on whole grain toast. Real dairy protein. No industrial phosphate burden. Number 1. Aged blue cheese. Blue cheese earns the most dangerous spot on this list for cardiac patients, and I want to be precise about why, because this information almost never comes up in cardiology appointments. The most urgent mechanism is tyramine. Blue cheese contains extraordinarily high concentrations of tyramine, a biogenic amine that accumulates during the extended fermentation and aging process. In healthy adults, tyramine is rapidly metabolized by monoamine oxidase enzymes in the gut and liver before it enters circulation in significant quantities. In seniors taking MAO inhibitors, prescribed for treatment-resistant depression, which is a documented and common comorbidity of cardiovascular disease, or for certain presentations of Parkinson's disease, this degradation pathway is blocked entirely. The tyramine in just 1 or 2 crackers worth of aged blue cheese, combined with an MAO, can precipitate a hypertensive crisis. An acute and dangerous spike in blood pressure that can trigger a stroke or cardiac event within the hour. This interaction has been in the cardiology literature for 60 years, and almost no cardiac patient is warned about it by name. Eleanor told me about a woman at her book club the same night she was there, who ate the blue cheese, developed a blinding headache within 45 minutes, and was taken from the room by ambulance. Blood pressure 220/120. Eleanor had avoided the blue cheese herself without knowing why. She had no idea how close the person sitting next to her had come to a fatal cardiac event over a cracker and cheese. Beyond the MAOI interaction, blue cheese carries an exceptionally high histamine burden. Histamine triggers cardiovascular reactivity, tachycardia, blood pressure fluctuation, flushing, palpitations, and sensitivity increases significantly after 60. The combination of high tyramine, high histamine, and advanced glycation end products from the intense fermentation process creates a cardiovascular stress profile that is genuinely inappropriate for cardiac patients over 60, regardless of their medication list. The swap. Replace the depth of blue cheese flavor with a small piece of authentic Parmigiano Reggiano. The same crystalline texture, the same concentrated umami punch, without the tyramine load or the cardiac risk. For crumbled cheese on salads, use crumbled feta from sheep or goat milk, far less tyramine, far lower histamine burden, and a mineral profile that supports cardiac health rather than threatening it. The 4 cheeses to eat regularly after 60 for cardiac health. Aged Gouda. Vitamin K2, arterial calcification prevention, bioavailable protein for cardiac muscle support. Authentic Parmigiano Reggiano, pre-digested complete protein, whole food calcium that protects arteries, naturally lactose-free. Aged sharp grass-fed cheddar, conjugated linoleic acid, anti-inflammatory fatty acid ratio, vitamin K2 MK4 form, vitamin D. Authentic Swiss Gruyere, ACE inhibitory peptides for blood pressure, glutathione precursor support for endothelial health, B12 for homocysteine control. The 4 cheeses to stop eating after 60. Processed cheese slices, industrial phosphate emulsifiers, arterial stiffness, fibroblast growth factor 23 elevation, pre-shredded bagged cheese, natamycin gut disruption, oxidized cardiovascular nutrients, histamine cardiovascular reactivity. Jarred cheese spreads, pro-inflammatory processed fats, industrial phosphate sodium burden, phthalate endocrine disruption. Aged blue cheese, tyramine hypertensive crisis risk, especially with antidepressants and MAOIs, histamine reactivity, advanced glycation end product accumulation. You do not need to eat cheese every day. 1 to 2 ounces of the right cheeses, 2 to 3 times per week, is enough to materially shift your vitamin K2 intake, reduce your arterial calcification risk, lower your inflammatory load, and support the endothelial health of your cardiovascular system. 2 important notes before we close. If you are on an MAOI for any reason, for depression, for Parkinson's disease, for any condition at all, please discuss your full dietary picture with your prescribing physician today. The blue cheese-tyramine interaction is one of the most serious and most underreported food-drug interactions in senior cardiac care, and you need to know about it by name. And if you have chronic kidney disease alongside your cardiac diagnosis, extremely common because the heart and kidneys share a circulatory relationship that means disease in one accelerates disease in the other, the phosphorus content of aged cheeses means you need individual guidance from your nephrologist before applying any general recommendation here. Eleanor recovered fully from that conversation. 8 weeks later, her cardiologist was asking what she had changed. She sent me a photograph of her new refrigerator. Aged Gouda in the corner, a wedge of real Parmigiano wrapped carefully in paper, a block of grass-fed sharp cheddar sitting beside the eggs. 1 line written underneath the photo. Finally, someone told me the truth. Take good care of yourself. Drop a comment below telling me which cheese is in your refrigerator right now and which one you are going to swap in starting this week. Subscribe to this channel. Share this video with someone whose cardiac health matters to you, because this is not information making it into most cardiology appointments anywhere in this country. Turn on the bell. You have been carrying this heart for a very long time now. It deserves better than what is sitting in most American refrigerators today.